Welcome to Her Business, Her Voice, the podcast dedicated to Black and Brown women who are building something beautiful. I'm your host, Myown, and every episode, we go deep on mindset, wellness, and business moves that help you elevate, not just in your business, but in your life. No fluff, no filters, just real talk with real women doing real things. You belong here. Let's go. Today's guest is a powerhouse in the world of healthcare and nursing leadership. Dr. Stacy Bentil is not only a doctor-prepared registered nurse with over 2 decades of experience. Her journey started when she was just 15 years old as a nursing assistant. From the bedside to the boardroom, she has served in top leadership roles and is now the founder of Bentil Healthcare Consulting and Leadership Institute. She is also the 2025 recipient of the prestigious Estelle Osborne Award. Help me welcome Dr. Stacy Bentil to Her Business, Her Voice. Welcome, Dr. Stacy. How are you?
Thank you for having me.
I am so excited to get this conversation started with you because it's going to go so many places. But the first place I want to go is sharing a bit with our audience about who is Dr. Stacy Bentil in your journey in your business.
Wow. How far back is this journey? Okay. So I would say Dr. Stacy Bentil is not just a leader and an entrepreneur. I'm a passionate nurse, caregiver. I breathe and eat everything nursing, such an advocate in healthcare in general, not just in nursing. I'm a mother. Dr. Bentil's a mom of 3 beautiful girls, a wife. So all the exemplary contributions of being a strong Black woman.
Ooh, I love
That exemplifies all the things that we do and all the strength that we bring and all our boldness. But in that too, I have a journey, and my journey in healthcare began as early as 15 years old when I started as a certified nursing assistant. And we had a program in my high school, and I wanted to go into healthcare, but was still trying to figure out the world. I'm like, yes, there's a physician, always wanted to be a pediatrician. But then I had my father got into a serious car accident. And healthcare got real when the insurance company, when he got discharged, said his home care visits for his wound dressings were limited. And after, his home care visits, they needed to show somebody to do his wound care because he still wasn't healed and he had pretty big, extensive wounds. So everyone in the house was like, not it, not it. And it just left me standing. And so as early as I think at that time now, I was probably around 16, 17. I knew how to do sterile dressing changes. I was already packing wounds, making sure I had my technique, my sterile field. So young, and to somebody that was so important to me. So I had to make sure that I was just doing things precisely, but I was healing my dad as early as a teenager. And then my journey began. Undergraduate, I went to University of Connecticut. Then I came out. I started as a new grad in the surgical trauma ICU. I was already packing wounds and doing all the things.
Because you already an expert at 16. Okay,
I
packing
was.
these wounds.
Being a CNA gave me like the groundbreaking work. I felt like I was the best nurse and better in nursing because of my CNA experience. I knew how to turn patients. I knew how to, toilet them, do their ADLs, dress them. I knew how to do all the mechanical lifts. So it really gave me the foundation of nursing. And that really tells you if this is something you want to do, can you do this, or a different realm in healthcare, or maybe healthcare is not for you. You kind of get that feel from then. And I would always say and congratulate and recognize certified nursing assistants, medical assistants, patient care associates, the techs. They do amazing work. Without them, healthcare couldn't stand. They're the backbones in nursing and nursing practice. So knowing that work and knowing what they do and being able to identify with them really led me to being the strength of who I am today. I mean, I was packing wounds as a teenager.
Right.
So I was able to do that.
I'd like to dive into going from being a nurse to what took you to, because I think it's always important to hear the journey to what got you to what your mission and your purpose now is, which is nurse leadership. And so what got you from being just the nurse, Stacy Bentil, to Dr. Stacy Bentil, who's the founder of the Bentil Healthcare Leadership Institute? What was that road like?
That's a pivot in knowing, I think, people recognizing your talents. So sometimes we have blind spots within ourselves, but your team may see something that you don't see. And I
Mm,
know when I was early as a new grad still, I mean, that's like, okay, off orientation, couple weeks later, you're a charge nurse. I'm like, me? I'm charged? I feel like I'm still new to the unit. It's an ICU, and
mhm,
then there's step down to it. And then after I was going back to school to get my master's, so I transitioned into ambulatory care to have that balance so I can continue school. But I was identified as charge nurse as soon as I was out of orientation. But they saw something, you know? And at first I was like,
mm,
they're initiating me, they're eating their young, you know. Not all of them were so kind, but one of them brought me to the side
mhm.
and we could talk about mentorship. But she saw something and said, you may be charge nurse, you may feel like we're, coming down on you or giving too much, but we wouldn't if we didn't see someone that could handle it. She saw something in me that say, what you're doing is leadership. You're always communicating with your team. You always have the willingness to help. You're precise. Your patient and the families that just adore you. You take time to give that care, even with all the busyness. You still have time for the patient's families, so they see things that you do, and may recognize that those talents that you have to say, okay, now it's time for her to go. Let's give her that push. So from charge nurse, I went into different positions. I went back to school to get my master's in nursing administration and leadership, and then I had remarkable opportunities out of NYU where I went for grad school to
Mhm.
partner and see more leaders and be with chief nursing officers and really know what the holistic approach is to being a nurse leader. And that's how I kept evolving today. And I still am.
Absolutely. So, if I'm a nurse, because what I heard you, the one pinpoint that stuck out for me is mentorship. And we know that as Black women, a lot of times there's no roadmap.
Mm,
We're
mm.
the first, many of us are the first in our
Always.
families,
Yes.
right?
Yes.
So, I have a two-part question. One, how important is mentorship? Is my first question. And then my second is, what are some of the steps that one should take to become an effective leader?
Right. Great questions. So, mentorship, yes, very important, especially today as healthcare is evolving every day. It feels like there's a new change, there's a new policy. Advocacy looks different than it looked when I was at the bedside. So, our future nurses need to continue to have that support. Have that mentorship. Our patients are more acute. They're very ill after the pandemic. We're seeing more very acute patients, very ill, and nurses do their best. The physicians do their best, but some days you take it home. The shifts are long, the shifts are exhausting,
Yeah.
but we keep pushing through and I love to encourage them to do more and keep going in the field of nursing. I think the importance of identifying a mentor is important too. Because some organizations have mentorship programs and try to support their nurses with new pipelines that they may have as new initiatives, but really identifying a mentor that understands you, that you
Mhm.
have alignment with. He or she is finishing off your sentences before you can, or they're sitting in a position that you aspire to be. And they've also probably had a mentor. So seek out mentors that can assist you in navigating the journey. So you're still having a great experience, but it's still bringing you through that ladder to where you want to be. That's
Now, I have
great.
a quick question. I've heard two different sides. Do you seek out a
Mhm.
a mentor or does a mentor seek out you? Which is the truth?
I've done both.
Okay.
And I say that's because, if you're in any position, whether it's in healthcare, whether it's in engineering, and you're really in alignment with someone who's prestigious to you, that's whether they're the CEO of the company, they're the VPs, or maybe just the lead, the director of a component of where you are in your field. You want to aspire. That inspiration and aspiration is important. So you may seek out someone that just like, I think she's really cool or she's really in alignment with something I want to do. Or every time I speak to Dr. Stacy, she makes me feel comfortable. I can really let out my feelings. I can really be myself. And her advice, may be extraordinary or led me to a next step that I can do. So I think those are important. But also, I've seen some nurses that's like, oh no, let's have this conversation. Let me take you under my wing and wear appropriate scrubs, or we may not want to talk like this in front of the patient and families, or,
Mhm.
that essential grooming. And I've met some nurses that's like spot on and quick. And I'm like, oh, I see a leader. I see someone who's going to be running the unit. I see this potential from charge nurse to nurse manager, from nurse manager to either coordinator or director. Those ones are identifiable too, because I was in that position. I was in both ends. I've had to be willed in and
Mhm.
got spoken to a few times, like, what were you thinking? And
Mhm.
also, as in, yo, you're doing an amazing job. It's time for you to apply for this position. And I think that's true mentorship as well. So both ways.
Okay. I know that some who may be listening are at that pivotal point where whether they are the executive and now they're bringing on team, right, into their business, or
Mhm.
if we have nurses listening who are preparing for a leadership role, I would love to know, what does that look like preparing for a leadership role? Like, what are some of the qualities that we need to have to prepare ourselves? And not just prepare ourselves, but again, talking to as Black women, what are some of the things that we can do? Because we know that
Yeah.
sometimes we differ from our counterparts,
Yep.
unfortunately.
Yeah, absolutely. And I think leadership, the term is very broad. Some people have a different definition of what leadership is and how that may be perceived to them.
Hmm.
But if you are a leader that's whether in entrepreneurship or rather in the private sector, like you're running a unit, you need to have the understanding of the business. So I always tell my entrepreneurs that, of course, are leaders as well. You are now the CEO of this company. It
Hmm.
is yours. You're a founder, owner, the principal, whatever. You're it. You're it. So that thinking and that angle looks different, whether it's in marketing, whether it's now you're overseeing front office staff, now you're overseeing medical, assistants, now you're overseeing nurses. How does onboarding look like? How are you ensuring that their skill sets are safe and they're competent? So that whole business model they have to now look at as the CEO. And that could be a different tier of leadership for most if they haven't had that experience. But the coaching, and that's when coaching comes in and is this mentorship to support them through their entrepreneurship to make sure that their business is successful. And if you're in the private sector, that business is already established.
Yeah.
You're reporting to CEOs, VPs, chief nursing officers, even the
Yeah.
CNO and the CEOs
Mhm.
have board of directors they have to report to. Now, how does that leadership lens look like? And what are their expectations of you? How do you assure you're successful in that role? And sometimes there's alignment and sometimes there isn't. And if when there's not an alignment, do you pivot? How do you navigate through that challenge?
Mhm.
And if you have direct reports, now everyone is looking to you. Everyone's looking to you as that final decision maker, whether it's emergency preparedness, do we shut down the unit? There's an exposure, there's, all different things that happen in healthcare. Your critical thinking skills, your sharpness, your effective communication,
Mhm.
these all just have to naturally come because you're it. You're that leader and they're looking for the outcomes. So those decisions that you make are very essential and critical.
Absolutely. I love that you say leadership has a different lens for everyone, and then you gave
Mhm.
us the insight from your perspective.
Mhm.
So as a nurse leader, when someone comes to you
Mhm.
and they say, "Dr. Stacy Bentil, I need help." What are some of the ways that you help nurse leaders right now with the Bentil Leadership Institute?
Absolutely. So in the Leadership Institute, I do a lot of consulting so I have mental health care consulting, and within the consulting business is the Bentil Leadership Institute. And I developed the Leadership Institute because I identified nurses and other healthcare professionals too that have gone. through the Leadership Institute that needed that leadership support. You need
Mhm.
that addition. What else isn't the organization providing to you? As some of my mentees would say, the real. They need the real outside of their leadership roles, that extra things that you can't be taught in nursing school. So I
Absolutely.
put them through the Bentil Leadership Institute. And in the Bentil Leadership Institute, I have a leadership framework. And it's called the BLEND Leadership Development Training Program. Now, the B stands for building relationships, because that's very
Okay.
important when you're in a leadership position, whether it's at networking events, whether you have to pivot to a different team or create building those relationships from bottom up and top down is important.
Mhm.
The L is for leadership, of course. And we talk about different types of leadership. It's very interactive on what makes them identify with the type of leadership that they are today and how those different types of leaders look like today. We know the history and what you learn in school, but
Mhm.
it looks very different now. So we have different tactics of how those leadership styles look like. The E is for ethics. We
Mhm.
cannot lose sight of the ethical component in nursing practice. So I
Absolutely.
definitely bring it back and I made them think about the ethical situations today. And they're so broad and so many different ethical levels that leaders have to endure. So knowing those components are very essential.
Mhm.
The N is for navigating challenges, and the D is still for diversity, equity, and inclusion.
I'm
I'm
so
keep
happy you said still 4.
it is
Everybody
still
else trying
for
to, like, X us out and count it out. Glad you said, "No, this is still critically important." But
it is. It is. And I say that because when you're in healthcare, you're providing care to patients. You cannot rule out diverse patients. You
Mhm.
can't rule out how you have to treat each patient equally. You cannot rule out how you include them. How do you include your diverse populations, whether it's through economic status, whether it's how they identify themselves today? And understanding how and why they identify themselves, really understanding LGBTQ and how you provide care to them. It's just very broad. Whether it's a certain type of religion, we still have the ethics to really provide care to them and still provide care to them is how we do it, how you understand them. I have a friend who taught me it's not about culturally being competent, because how are you competent in somebody else's culture?
Right.
But you have to be sensitive to it. It's cultural
Mhm.
sensitivity to really understand and learn from your patient, from their families, and how you bring the care to them.
I
So
love
it's
it.
definitely something that we go through, and leaders go through this with even their diverse teams today. So, how does that look like for the leader? I had a nurse entrepreneur say, "Hey, I opened up my own practice and I'm getting diverse patients, which is great, but I also don't know how to treat these new patients that are getting from
Mm.
the
That is interesting.
LGBTQ." It's like I never
Right.
had to treat a transgender male before, it was a new experience for him as a new entrepreneur, but it's still very critical, very important. So we definitely cannot rule out and will not rule out diversity, equity, inclusion. Belongingness is so important.
Say that the blend program, I'm sure you're going to agree with this, is a necessity across the board in higher education, but also if it was missed in higher education, that our healthcare systems,
Mhm.
i.e., hospitals, surgery centers, retirement, assisted living, etc., should add this. When we were CNAs and we
Yes.
have certain amount of credits you had to take every year to like
Oh,
be
yeah.
compliant in order to keep your
Yes.
license.
Yeah.
Blend program should be a program that is mandatory, and I don't know, like, how often they have to re-up, et cetera, but it should
Yeah.
absolutely be mandatory when you enter a new institution or when you've been at an institution for a certain amount of time.
100% agree.
Because I find that what you learn in college, and this is just from my own experience,
Yeah.
is nothing compared to the real world, real life experience. And that's what you bring into the blend program. Like your over 15 years of experience, but also your experience, not just in education in your own schooling, but your experience on the job.
Yeah.
And it's not just on the job in the US. You are a global trainer and speaker. And
Yes.
so that even brings something different because as we all know, not just in the US, but globally, folks are from different areas of the world.
Yes.
And so again, that speaks to that diversity
Mhm.
and knowing
Mhm.
how to work with and help, right, those who come from a diverse background. And so I would, whoever is listening,
Mhm.
I implore you to push this through to your executive team to say, hey, we need the blend program. I would implore higher education systems, if you're
Mhm.
listening, that you bring in the blend program because I see more and more that they are actually bringing in and asking those of us who work
Mhm.
in the real world sector because they're just throwing the folks out to the wolves when you throw them
And
in.
that's exactly how they feel, and that's exactly how and then it's only a matter of time you start seeing those outcomes in patient care,
Oh,
and
yeah.
that's not what you want. So and I even think for the private sectors, whether it's for profit or not for profit, anytime we're bringing a level or a new tier into a new nurse's job, going from charge
Mhm.
nurse to coordinator, from coordinator to manager, they also still need to go through the Blend Leadership Development Training Program because it's a lot that they're going to learn. Can you imagine you being on a unit with your colleagues and your peers, and you guys are all working together, turning your patients and covering each other, and now you become their boss? Now you've advanced, you got a new role,
Mm.
which is great. We're so excited for you, but it's on your new your same
Awkward.
unit. It's awkward when you're now the
Now
nurse
you telling me when
manager.
I can take my lunch break.
I'll approve or deny your vacation time or sick call. It's just really
Mhm.
how do you manage and support that new nurse leader? How do you support and provide the skills for a new director of a big you know, system sector?
Yeah.
It just looks so different for all. And that support needs to continue. And they need to go through how to effectively build these relationships, how to navigate the challenges that they're going to endure, and the challenges that is interactive sessions that I mentioned, but they're very realistic as well. What would you do in this situation? And we talked through those things. So it's not a text, it's more filling in the gap that you
Yes,
didn't learn in school,
absolutely agree.
mixed with the real life scenarios and situations.
Absolutely. If you could leave one or if you were to leave something or what you wanna leave and embark upon the world, what's the one thing that you wanna leave here? Like your legacy, what is it that you want people to know, and what do you want to come from the Leadership Institute and from the work that you do?
I would say my compassion
Mhm.
and my perseverance for the compassion for the work. Because we can all say we have that compassion, but compassion comes with a lot of strength, that perseverance, that keep going, that determination to continue to have the compassion. Um, is important. We all have things that we're passionate about to do,
Mhm.
but my work comes from the heart. It comes from pouring a lot of the time and efforts and readings and research into what I bring out and pour into
Yes.
nursing, and not just all nurses, but especially nurses of color.
Absolutely. I love that. So where can we find you, Dr. Stacy Bentil? Where are you hanging out at?
I'm everywhere. 2026 is here, kicking in full force. I have a good amount of speaking engagements, but definitely if they need me to come speak or learn more about my consulting company and the Leadership Institute, they can find me on LinkedIn, the Bental Leadership Institute, Instagram, Bental Leadership Institute, and Facebook, Bental Leadership Institute. If they want to get me one on one as well, Dr. Stacy Bentil, they can find me as well, personal pages.
All right, perfect. I thank you so much, Dr. Stacy Bentil, for being here and for sharing about nurse leadership and the work that you are doing and setting upon in the world. Because without you, I feel like nursing would be at a struggle point. And so I think it's extremely important to get the message out about the work that you are doing in nursing and healthcare systems with your work. And so I thank you for being here today.
Thanks for
And
having me.
absolutely, absolutely. And until next time, everyone, remember her business, her voice, where we focus on mindset, wellness, and your business. See you next time.